Thank you for joining us in our 11 Breaking News Center. Once again, I'm Carl Lahada, your digital anchor at KKTV 11 News. Joining us here today, Steve Carlton, Chief Clinical Officer for Gallus Medical Detox Center. Hey, Steve, so good to have you
Hey, Carol.
again.
Thank you. Good to be with you.
We were just talking a little bit. The last time that I spoke with you in our 11 Breaking News Center was for Dry January. And today
Mhm.
we're going to touch on a similar topic with alcoholism, but let's start with the basics. What's the most effective way to treat someone that's dealing with alcohol issues or that's just drinking too much?
Yeah, great question. So the most effective way is really what works, right? I think you start there. For people with substance use disorders, typically they make a lots of attempts and they make different types of attempts. But what we know is connection, sort of long term, sort of sticking with it, having some type of connection to a recovery environment or recovery source. And that coupled sometimes with some type of medication for cravings that reduces use, that can really be a winning ticket for people.
You just mentioned it. So, part of our segment today is going to talk about this new medication to help people that are dealing with alcohol issues. So, tell me more about this latest medication that's out there to help.
Yeah, this a recent clinical trial was released. It's a medication called Otezla is the name brand. Apremilast is the generic name. Otezla being the brand name is a medication they were using for psoriasis, which is a skin disorder. And what they found is that people taking this medication drank less, right? So when they had people with more significant alcohol use disorders, people that were drinking upwards of five or more drinks per day, it knocked down their drinking to about 2 drinks a day. So these were not people seeking treatment for alcohol use disorder. These patients just had this unintended benefit from this medication. And so that's really interesting. And they ran this clinical trial where they did a double blind trial using a Tesla and a placebo, and they found that while people were taking this, they were only consuming on average about 2 drinks a day, which was significantly less. And so that's huge in a field where we haven't really had much innovation at all since 2004. This could really be a breakthrough. There's lots more that needs to be done to make sure this is safe and this is long term effective, but when you're talking about alcohol use disorder, you're talking about a problem that affects anywhere from 14 million Americans all the way up to almost 30 million Americans meet criteria for alcohol use disorder, depending on what source you're looking at. And 1 in 5 deaths of people 20 to age 49, alcohol is a factor in them passing away. And so this is a really significant problem. So this breakthrough um, is exciting, and hopefully we see some more benefit and traction with this.
So, you say it would reduce someone's alcohol intake to like 1 or 2 drinks a day. Is it okay for the average person to have that many drinks a day?
Yeah, another great question. And this is one that I get all the time. Like, what are safe levels of alcohol use? And there's lots of ways to look at this and things to consider. What doctors recommend is for men, you should have no more than a total of 15 drinks per week, right? And for women, that number is 8, right? And so anything more than that in a 7-day span can start to have negative impacts on your health. And so that's what we know. What people at home watching this should understand is the other things to think about is, are you losing control of how much and how often you drink? Is it starting to cause consequences in your life? Are you making risky decisions when you're drinking that could cause harm to you or others? And lastly, is it causing a tolerance? Are you needing more of that substance to get the same effect? And when you stop drinking or using, is it causing withdrawals? Are you getting physically ill when you stop drinking? And that ranges anywhere from sort of a mild hangover, a headache, and feeling bad the next day, anywhere up to shakes, sweating, seizures is obviously the most concerning there.
Steve, an important thing for people to remember if they are trying to reduce their alcohol intake is that they shouldn't do it immediately. You shouldn't just stop drinking. But why is that?
Well, alcohol in particular, if people become badly enough dependent on alcohol, where when you stop drinking, you start to get sick, trying to do that on your own and in a certain in some of the population that can become fatal. And so it is predictable though. And I think if your drinking has gotten to that level, people typically know that they are feeling shaky, they're sweating, they're having vomiting, diarrhea, they get disoriented. It follows a progression, right? But the window where it's most dangerous is at about that 36 to 72 hour mark after your last drink. That's when you can start to have seizures and really severe alcohol withdrawals. And so because that reason, you need to go into a medically managed detox program where people can help you safely detox off of that substance.
Staying on this tangent, what are the types of care that are available to people dealing with alcoholism?
So for alcohol use disorder or any substance use disorder, we talk about the levels of care. And so the highest level of care is what we do at Gallus Medical Detox and what we do a really good job of, which is medical drug and alcohol detox. So that's typically a short stabilization period. And during that period, clinicians at Gallus determine what level of care do you need to be successful. And that might be residential treatment, which is what people commonly think about as rehab, right? You go into a program for anywhere from 2 weeks to a full year of care, and you live somewhere where it's a structured environment with professionals around you that are supporting you in your goal of typically abstinence of not using. Below that is partial hospitalization. So this is what we would call day treatment. So people either live at home or they live in a sober living environment, but they go to a treatment program for usually 5 to 6 hours per day. And they do treatment all day. They meet with therapists. They do groups. They potentially do medication management. 12-step or other mutual support meetings are typically a part of that. Below day treatment is something called intensive outpatient. So if they are able to maintain abstinence or whatever their goal is and continue to work, this is a good option because it's roughly 9 hours a week of therapy. So it's still a pretty high level of care, but it's typically done over 3 days for 3 hours, right? And so a lot of programs accommodate working people, so you can show up from treatment from say 6 p.m. to 9 p.m. right in the evening, so it doesn't completely disrupt your life. That's a really good option. And then below that, you have outpatient, right? Going and finding a good therapist, going and finding a doctor, prescribed medications, right, and maintaining that way.
Steve, maybe the most important step is the first step, which is getting help. How can people do that?
It's really hard. The first step is typically the hardest. Admitting you have a problem is filled oftentimes with so much shame and embarrassment that it's hard for people to get over that threshold of acknowledging, like, I have a problem and I need some help. But once you get over that hurdle and you find quality care, people typically gain confidence. They gain more hope that they can do it. And what's really interesting about this Tesla, this new drug, and other drugs similar to it, is that if you can get people to reduce their substance use or even quit completely, what people often tell me is, I couldn't imagine that life could be this good, right? There's all sorts of benefits that people just don't know exist until after they quit. And so if you can take that first step, get into treatment, start doing better, a lot of people are surprised at what they find when they get some success under the belt.
Steve Carlton, Chief Clinical Officer for Gallus Medical Detox Center. Always a pleasure to have you in our 11 Breaking News Center. Great information again on alcoholism and new medications and treatments. We're going to have more information about Gallus Detox Center in the article accompanying this video. And Steve, we hope to welcome you back soon in our 11 Breaking News Center.
Thank you, Carol.